It sounds good. What I had in mind is basically just to go quickly through the resources that we might want to think about, just that like the as a final kind of um how do I put it? As a final kind of like discussion about it, because I've heard a lot of people talking a lot about a lot of resources, but just like the best resource, and then hopefully like the minimum amount or the minimum number of hours we need per week if we're going to say that we have 8 more weeks till the exam, not counting January. So if we say it's 8 more weeks, the minimum number of weeks is hours per week that we require. Also, what mocks is best to attend, if there is anyone else that, apart from the Oxford one, obviously, if there is anyone else or any other places that we can take mocks. Also,
Okay.
what's the best approach maybe to study with someone, and if there is a specific criteria that, or not criteria per se, like a domain kind of paper or anything that we can go on to maybe check list each other, to just be aware, because sometimes feedback can be good and sometimes feedback can be just noise, extra noise. So
Definitely. I think yeah, this was also point in in my mind when I tried to put like quick. I didn't like have enough time to do this like a comprehensive slides, but I this point it was in my mind when I put like because this the things I struggled with, and I was hoping today that other people uh from the previous cohort to attend, but it seems no one is like have free time today. So I will answer all of this question. So I said like this will be shared like shared experience from other people, but it's only me today, so we'll try to maximize the benefit. So yes, the first question you mentioned about like what is the best approach? I was saying for like divided it as slow reader and fast reader. If you are like myself, slow reader, I would say like this is a different approach. But as far as like now we approaching the exam, and I think all of us like around is going for January. So I would say go for to practice station. Don't bother by reading a lot of literature or like reading, oh, I'm going to read about like guidelines for treating with anxiety and all this stuff. And one of colleagues was asking me, what do you have any summarization for the SM5 for each like you don't need to do this. You are able to diagnose the it, like disorder, and you have only 6 minutes. You need to like speak about the 4 or 5 domain common symptoms from like core symptoms, and you need to exclude the comorbidities as well. So you cannot do this like checklisty, and if you appear as a checklisty you will be marked less than if you appear natural. And by appearing natural, you just like okay to go with the flow to speak about like okay when did you start, onset, course duration, and then main core symptoms, and speak about like comorbidities, exclude biological, psychological, and any social stressors, and exclude others like substance, and check about coping and what else? Coping, and have this how is this impacting how he is coping. So if you're just like slow reader, I would go so as again like speak go to practice the station and know your weaknesses with each station. And especially this history, I'm speaking this bit disorganized, so I need to be more organized. If this is the case, for management, usually we have all the management in our mind, but the issue that is you need to put the patient at ease and to listen more than you speak. Even it is managed. Don't worry about like something you didn't mention. If you give this like the role player more time, he will give you the prompt, especially for in management, which most of us worried about. Oh, I didn't mention this, I didn't mention that. Okay, so I would say at the moment to try to like if you have 2 months about the exam, try to practice more, but also with some quality. Like for example, this was my next thing you want to speak about. This a group. If you have 2 months, I wouldn't be bothered by like having a lot of groups that make me distracted, rather than to focus on some like have like small groups with like bit of quality about feedback. And what will answer your question, Ala, about that, like if you want like some checklist to give a feedback, SBMM is the best in this way. But don't be mistake to it, because sometimes he, like for example, in some station he bought like 3 or 4 domains about like history, and in this station you don't need to ask about history like as this, like just you need to put have 1 minute with patient to speak about him to get him at ease, but you don't need to take all this history. And sometimes you find SPM putting like 3 domains about history.
Mhm.
Do you get what I mean?
Yeah.
Yes.
So, but if you are the one who's like able to focus and not be bothered by a lot of different feedback, go with larger groups. I wasn't the one of this. So last exam, I just go with very small group, like very like we just like practice 1 day, 1 hour a day, or 1.5, 2 hours maximum. Been working. So I preferred small groups because it gave me the quality about to focus about this different station.
Okay.
Uh, But again, if you feel that like you get most benefit from larger group, and this help you with exposure to more people, and also one of the good about the larger groups or practicing with different people, that this decrease the anxiety and make and like increase the exposure, which could happen during the exam because you just seeing the people for first time and like different people on the same day. Uh, Mock exam. Uh, I would recommend mock exam, definitely. I would recommend if you have any chance to do any mock exam, do it. Any mock exams will you will have a lot of benefit from it. I think the trust doing one. They didn't do
Yes.
last cohort, but they do usually they will have mock exam. So try to do this. Sometime Merseyside as well doing one. If you can ask other people and like our colleagues from Merseyside, they do a very good one as well. SPMM, I believe it was very good, but last time or before last time, it was very near to the exam. So if I'm saying you go for mock exam 1 month before the exam, so this give you like uh, some some feedback about your weaknesses and also your strengths. So you need like to, okay, I'm good in this one, so I'm okay, I'm confident about doing this in this way, or my communication is fine, my empathy is fine, but I need to work on like be give more silence to the patient, so I will work on this. Don't go for like the mock exams that will be before the exam 1 or 2 weeks. Please don't do that. There is a lot of other groups. I think there is a lot of groups CASCers is doing at the moment. A lot of people doing it. I did only have more cluster exam. Just like in the morning, I wanted to know, and I didn't want to have a lot of different feedbacks. I wanted just like to check what to check my performance at that time. So I did half of the mock, and I was planning to do half it, like half of the day morning station. I thought I will do the other one, but I just got busy, so I didn't do it. Why? And I didn't want to do it before the exam. Uh, I think Mozilla is fine because if you just if the first time you have uh, like uh, like if this first trial, I think Mozilla will sorry, Oxford will be fine because they do in Sheffield, so you travel and then you will have more or less similar experience from the exam, the day of the exam. SBMM, they try to do it like it's more or less similar to what happens at exam, even with the checklist, and they bring like examiner from people who work as examiner as well. Uh, I given I would say like if you're practicing at the moment, you try next month, that like December or by mid of December, if you just like do 8 station or 4 station each, but like back to back, and then you have a feedback. after that, this will be very helpful. And if you can do it like each station, for example, if Gopal and Ahmed's like having practicing, so they like today Ahmed will do each station, tomorrow Gopal will do each station, or like Ahmed do four, get his feedback, Ahmed do four, get his feedback, or like for example, Gopal do four, Ahmed go for the next four, and both speak about the feedback. This will be more helpful because this will a lot of people and a lot of our colleagues was like having difficulty saying I've been doing well during practice, but when I was in the exam I didn't have a chance to I didn't feel that like I can like think about the station between each station. So practicing for a station or each station will help you to get the stamina for the exam, I would say.
Mhm.
uh, Constructive feedback is very important. I would like usually I did like to give when I give feedback what went well, how can we improve things that or like there is a room to improve. I did not like to just like think about negative feedback. Uh, Preparation feels like long time. I am thinking about like 3 months, 3 days, 3 hours. Like if you have like 6 months, you just like 3 months slow base, 3 days a week, or 3 hours a week, 3 days as well. Uh, uh, if we just like approaching the exam, as I said, like try to practice most of the station. And by the way, like this answers Gobal asking me a question. SSBM, I would say is more than enough. Only if there is a station outside just came in that's just came in the previous recalls, do it from the like from whatever source you find, and this is not that common you find, but you definitely will have you will know before the exam that this station people speak about like cat or like IBT. Don't worry if it like it hasn't people speak about, just practice it to get familiarized with it. But don't worry even if you don't know, because if you just like it will be difficult for everyone if it's a new station. And just like you trying to practice it, it will help you to get like pass mark.
Mhm.
Um, Try to 3 days. I would recommend 3 days relax before the exam, to be honest. If you can do it, do it. If you don't, at least one day before the exam, you should relax. You should do nothing. I did went before the exam 1 or 2 days, I believe, and I tried. I was telling everyone's there like, okay, anyone going to eat, do anything, I'm happy to join them. Which are like just, but I went to familiarize myself because I my sleep is not great, so I went like to be able to sleep to. Uh, if you first time there, like try to have a walk first before the day before the exam or today, go to the hall, even they like the building is open, go inside, because it's if you staying in Ibis or like Holiday Inn, which is the nearest one, and I'd like to stay near the exam and walk. You go there, like familiarize yourself with the building, with what the walking, have your umbrella if it is like rainy. This all small things makes you at ease if you're going to the exam, which I totally recommend. Like all of us has passed the exam. Alhamdulillah, first and paper A and paper. So we have knowledge. Don't worry about knowledge. Because I have one of my colleagues, he was trying to literally study every lesson related to the station, which is so too time consuming. So time consuming. And we all like practicing. So it's not about practicing. It's not about like your knowledge or how you communicate with the patient in your like day-to-day life. It's just about how to prepare the exam. So from now to the exam, try to have balanced approach. You have been studying, for example, and I was speaking about she had been preparing for 1.5 months. Try to balance like from the next 2 months. Practice, but also do not to try to burn yourself. So this will come to what we said about the quality. Look for the quality of practice rather than the quantity of practice. And this because this will bring something I will mention later. Uh, Anything so far? We would like to be clear.
Oh, I think you've explained also. So yeah, so the SPMM, sort of the SPMM 2025 document, and then the stations that have come up in the past, seem to be enough. It's just like because when you look at SPMM, like on the face of it, it looks like there's quite a lot, but just based on the number of pages. But then when you look at like the number of lessons, it all seems like quite a lot of them are like variations on a theme. So if you've, I don't know, correct me if I'm wrong, but if say you were to learn like the basics of a station, um, that sounds as though it's better than learning a station inside out than trying to repeat it in the
Mhm.
exam. Is that what you're trying to say? Because they can change things, can't they?
They can change, and they will change something in the station. But if you worry about this, you might miss it. I don't want you to worry about like if they changed something about the station, because try to be open, because they will try to do something. And people, what like affected people negatively, that they went to the exam and okay, I have this station in MOOC, and they said the same name of the patient, and they were practicing this before, which impacted like how they like, okay, you are mentioning me with different names, or like they thought that like this patient has been brought with suicidal thought, but he in the exam it was different. So yes, I'm saying yes, try to have like general for history, have your schema for history. For mental state, have your scheme for mental state. For management, have your scheme for management. But if you go, if we say it's like in management for older, like in management for older adult, it will be the same as general adult, but you need to focus on the social part, like, and risk. And when you do the risk in like older adult, it just you need to be mindful about like risk of falls, using like electronics and like utilities at like, or like things at house, things like that. Just a bit of small changes. If you're speaking about management and children, you ask about like supporting carers, but all you will speak about biopsychosocial, but like bits and pieces which you can add as your notes. But don't, if you just spend every station with SPM reading all of it slowly, you will spend a lot of time, and also you forget like all these details, which might be difficult if if you don't have enough time before the exam.
Yeah.
Am I clear so
I
far?
guess, yeah, I guess it's around not going in with a pre-assumption about that station. You have to just be aware, the very first thing that a lot of task passers has told me is basically be task oriented. Task orientation is very important because you don't want, if you don't do a task, you're failing. But if you do a task and an extra thing, you're not going to be marked negatively. So basically just be task oriented, and as you go through your task, and as you go through your station, together with your communication skills, you're gonna know the station anyway. So for example, one of my friends that passed that last CASC, she mentioned something about an LD station that had everything was negative. Everything was negative. She asked about everything basically, although it was similar to the one that she got in the mock, but she asked about physical abuse, sexual abuse, pain, change in medication, change in behavior, change in circumstances, any sensory or yeah, like any sensory changes, like any eye infection, ear infection. She asked about everything basically, and she passed it. Although there's nothing positive in it, she passed it because she went through the structure that she had. Although she didn't elicit any positive things, because basically there is nothing positive in it. They just want to know what you need to ask about and what you don't need to ask about.
Yes, exactly. But I tell you something, if people ruminate about this station on the day of the exam, or if, for example, if this is a morning station, what will happen? Because we use it to practice something. People will start, oh, I elicited something and you didn't like, I use, and you start to feel, okay, I did everything, but patient like didn't tell me any positive. So I might miss something, or my patient might didn't like me, so he didn't tell it to me. So I'm going to fail it. If you start to think about a station like this, this will impact uh, your performance in the next station or the afternoon station. Which please do anything. Just try not to think about any stations. Once you finish the station, try not to think about the station. Once you finish the morning session, don't speak about exam. Please go do anything, like just relax. If you have a shower, have a lunch, do anything, but not speak about any station, not to think about the exam.
Mm.
This is like, I would say you should do this. And at the end I would say something like everyone is different and preparation is different, and but the things that like everyone telling you, please don't try to do this, even if you just remember, oh, I didn't do this station, like, and this station came yesterday and I didn't do it well. Don't do it, because if you start to do it, like, you'll miss something.
Yes.
Okay.
Mhm.
Anything, guys?
Mhm.
Everything's fine. So it's very important on the day of the exam, sleep. Very, very important. Try to sleep very well. Uh, Travel early if you can. Uh, 2 days, 1 day. Uh, it's up to you. If you taking any medication, uh, take it with you. You can take it with you in the exam. No one will say like, if you can take it in your pocket, no one will have a problem with this. Uh, if you start to think about any station, try to distract yourself. And just remember something, because of I was speaking about like the station, negative station. Yes, you're right. As I mentioned, if you start to think it about like that, this station I practiced it with the colleagues and it was difficult, you will start to uh an anxiety will start to be built up, and you might miss something. And what happens usually, I have this from an examiner, that usually they do the station in the morning. There is a lead examiner who asks people to do the station, and the examiners agreeing about competencies, which is different from day to day, and the lead examiner agree about this, and then the role player will have like doing the station, and they will agree about how they will perform the station in this circuit. So you might do one like group A, or like a global group 8, and you'll have the station, but the finding in this like circuit is different from the second one, even it is the same station. So
They're so
like for
cheeky, aren't they?
uh, it, because as I mentioned, like this is when I understand about how they prepare the station. I did manage. Okay, if I miss something, it doesn't need to be I miss it. It might be not there from the beginning.
Mhm.
And because it's like there will be variations, that imagine all the examiner do the station agree about domains, that they will mark people about it, because it's try to avoid if it is so difficult. And the role players will agree about how to perform the station, is like they
Mhm.
will be easy coming, they will be difficult. So this one thing, like, put on your mind, so you can it's just not to worry about like marking at that day. Try to focus on your performance. That's it. And this will bring something. I'm speaking too much, but try to stop me. And this one thing, because I just like I was speaking to one of my friend. I give him some compound question, and I said he's a consultant. I said it's okay now to speak about like compound the question and ask you multiple questions same time, because I finished the CASC. So, but this is not something you don't do in the CASC. So stop me at any time. Uh, if you have a chance to act with the role player and to have a feedback from them, please do. There is a lot of role player doing this paid. as people doing CASC as well. So if you have like chance to do it for once or twice, do it, because it will, most of our, like, sometimes we are hard to each other. If I'm like practicing with Ahmed, he will say like, okay, if he will try to help me by making it more difficult for me, but this not usually the case.
How do we get in contact with these role players?
Yeah, that's a good
Uh,
question.
hmm? I can send you contact of one or two role player which I know, and one of my colleagues, he didn't do practice with anyone. He just practiced with role player, and he passed. He didn't practice with anyone literally. He just did like few more session with this role player, but he managed. And I think one of
Mm,
consultant Dio as well. He did was he advised about this as well.
mm, mm,
So this is one of the like helpful thing. If you say to me like, do have of the mock with any of people who's like doing mock exam, or one of mock exams that's available, or like, and then do have mock exam with a role player, just like to have as like you speaking to a role player, British role player, who was attending the exams as a role player, not as a colleague. It will be
mm,
also a bit of helping, but
yeah,
it's not mandatory if you have a chance and want to do it.
mm,
I think we speak about material. Mozilla is very nice, like in having a lot of like uh, different scenarios. Get through is very organized if you want to read how you what kind of questions you want to ask. Much more better than SPM, but SPM is more like similar to the exams. Do recalls is like, at the moment, if you ask me what should I do till the exam, I would say just stick to the SPMM and do recalls. If you have time to do something, do it, like, as try to make self more open to everything, more open to changing the scenarios and stuff like this.
mm,
Your own notes is very important. If you have been practicing for some times, just have some times with yourself. Oh, I'm doing mental state very nice, but I'm a bit struggling with asking about delusion, other delusion, or I'm asking, have a bit difficult asking about thought alienation. How can I ask about this in a very smooth way? So, and like try to think about like different station of mental state. If you're struggling with one of them, try to practice it and have your own note about this.
mm,
Uh, the take home message like is like, I I know people was practicing together. Some people was practicing together, and one of them said like, "Okay, I'm not practicing with those guys because they making me slow. They passed. He didn't pass. So if you take it from different like twin-win situations, that I'm helping and someone will help me and we helping each other, I think this is more worthy, like, because at the end of the day, no one knows what time you will manage to pass, and what could be the thing that, because many times a lot of people just like not passing on very small thing, so you never know. I would say try to remember it's just an exam. So don't burn out yourself. Don't stress yourself too much for just the exam. Uh, and it's just an exam, so preparation, it doesn't reflect that you are a good doctor or not, because I believe like we are very good and we care about our patient, but that's not what we do every day. So it's sometimes being over prepared or overdoing things make it more difficult. Do you get it,
yeah.
what I mean?
Yes, I mean, reflecting on the part about charity and النية, I basically passed paper B just doing that, just helping others understand statistics, and I passed on the margin, seriously. And I would highly advise that. Just try to help any and everyone around you. It will help you in so many
Definitely.
different ways. So I do agree with you, Dr. Mahmoud. I 100% agree with you.
And
And
I can
yeah,
point people past with this, but because confidentiality, I wouldn't say.
yeah. Just one more thing as well. Sometimes when I'm and don't get me wrong, but when I am with my patients in community, especially because it's not as urgent as seeing patient in an acute setting, when I'm with my patients in community, sometimes a lot of what we practice does really help me, and sometimes I do change the way I ask the question based on different patients as well, and it really does help a lot. One of the advices that someone also gave me was to practice with your consultant in your supervision session in the hour. Tell him, I want you to put 2 minutes on your stopwatch, and I want to explain to you the ECT in 2 minutes. Or I want to explain to you the management plan around lithium as a patient. Don't talk to me as a consultant. Just try to understand it as a patient. And I'm going to put 3 minutes on the time, and I want to practice this with you. And tell me if there is any different ways to ask that, or to express that.
This is a very good point. Thank you, Ala. Uh, I would agree with you. Uh, one of our colleagues as well, he didn't practice too much, but he was like working in community, and what he was doing, he was going like, I'm doing today mental state for everyone in 7 minutes for everyone I'm seeing, and he was doing this. And next day I will do management for everyone in 7 minutes, and I will continue like the consultation as usual. And he did boss as well. So there is no single strategy fit everyone, and but like different things. And I would say if you don't know what fits you or what works with you, just do it for some times and reflect on it. And if it works, that's fine. If it's not working for you, just change it. So this is a very good one. The only thing I would say, be mindful about if you like practicing with a consultant. It's very important and it will be helpful. But I would say some of the consultant make things difficult because if they are not examiner, they will start to think about different things that it's very important, but it's could be difficult to do during the 7 minutes.
Mm,
So
mm,
if you think it, if you, if this, and it had negatively impacted some of our colleagues that they didn't feel okay after this feedback. This is why I'm saying it just the exam, because you're doing very good mental state, but it might take 10 minutes or like 15 minutes. But you need to do it in 7 minutes. I tried with a couple of consultant and I did refrain. I didn't do it because they were giving me like feedback in half an hour, which
mm,
I wanted like more concise feedback. So I didn't do it like when last time I didn't, last cohort I didn't do it.
mm,
Uh, So try to be mindful, try to be easy to yourself, and forget about the exam. You need to be focusing on this exam. So if you're taking like, if I'm doing this with my consultant at the moment, I would go with like that, like competency domains. Please have a competency domain. Have it as like as a patient, and tell me as marking how you mark me, because when we did it with a couple of the consultant who has not been examiner, they were trying to help, but it gives like, oh, I missed this and this. Okay, I'm not going to be to pass the exam if I'm practicing like this.
mm, mm. Yes.
Uh, so no single strategy fits all. Uh, yeah, this is everything I believe, but I'm open to question.
No, we really appreciate you, Dr. Mahmoud. That was really helpful, and think يعني إن شاء الله we're going to all pass January.
I'm
I
sure of that,
I don't
inshallah.
I don't want to think about taking the exam again.
No,
But inshallah
everything
we'll pass.
it will be come right time. I did multiple attempts. I would say it will be more difficult if I pass it from the right time. So it like when I did it like another time it was more helpful. I reflected on my practice and I got like some improvement on my practice with my patient, which I value at the moment. It could be like impacting, like it wouldn't be suitable for moving at that time due to different reason. So to be on right time, don't be you don't need to think will be like either now or never. No.
Mm.
I told Gopal earlier if you want to have some station and we can do them and have like give you feedback if you want, that's fine. If not today, I can join another days when you're practicing, guys, and can have some feedback as well. Uh, that's absolutely fine.
Yeah, thank you, Mahmood. Really appreciate it.
You're welcome.
Yeah, I suppose probably I was keen to see what day did you do yours on, Mahmood?
Friday.
Friday. Okay, fine. And can you remember roughly what came up? We can talk through it at some point about sort of the stations that came up in the morning, the afternoon, and how they differed from what you'd expected. Did you have you been given your feedback yet?
Just like a pass, not pass, things like that. But
All right, okay.
trying
Yeah.
Uh, I wanted to do it, to be honest, but I didn't have time because I'm doing my appraisal at the moment and half
No,
of
that's
the
fine.
team is off
We've got
sick. But
got time.
I can just give me because I wrote it somewhere. Um, I will tell you which station did come to me. Uh, 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 uh,
Did you have the family therapy one with the child Joshua?
uh, I think so.
That was a tricky one. A lot of people didn't pass the station.
Uh, was it history or was it?
It was explore the family dynamics
Hmm.
and address concerns, and they specifically told you not to talk about the management or don't
Oh,
talk
okay.
about, yeah. It was a psychotherapy one about family dynamics, basically.
Hmm. Yeah, I think so. Yeah, yeah. It came to me.
Yeah.
No station today, it seems to. So I think I got transference, family dynamic one,
Transference.
very
Yes,
little,
transference.
uh, very little abuse. Bipolar affective disorder, currently depressed, review medical condition, alcohol and clozapine formulation and talking to the sister, morbid jealousy partner. Physical examination, Lewy body, perform focused examination. What can I do, Gubal? I can try to trim because I think I put it like the note on one of like notebook, but I will try to have it more organized, and then we can meet again and reflect on them if that's okay. And I will try to also to have a look on my the feedback because definitely, I went out of this day and I called one of colleagues who is consultant and he was examiner at some point and I said, I don't know what's going on now, but like there is some station because I've been CASC examiner before. I said to him, if I'm if I'm the examiner, it depends on the examiner totally because if he's like wants like someone we will give good positive feedback, he will say, Mahmoud, like, he was doing good rapport with the patient. He knows everything about the station, but he didn't have time to complete it. So this man, he will just like give me a good pass, or at least boss in this station. But if the same, like if in the same station, same performance, but different examiner, he's saying, okay, he was very like he was good in communication and he like giving time to the patient, but he didn't like complete the station. So I'm not giving him the mark. He will fail me. He said, "Don't. Yes, it could happen, and there is a lot of variation, but don't worry about this. And you will imagine that some station, you tell yourself that you didn't do well, and you find yourself have a good score, and the opposite completely. And this is the same with myself and my colleagues as well. Do you remember one of my colleagues? He was out nearly to cry about one of the station. and he passed.
Okay.
So that's why try not to focus on the other people feedback, because someone will say, I did ask him about suicide and he said he will commit suicide and kill his wife. And when you ask another one the same day, he would say, no, he didn't. He say, no, I will never touch her. I'm being together. So don't worry about this, and don't worry about your performance and how do you feel as well. And try no not to look to the examiner, not to look after he did. Like if you can say like be cheerful or something, but try to focus, because people was happening that they just like saying, oh, the examiner was just writing from the first minute, so he must be giving me like a very negative feedback, right? Please try, don't consider he might be doing the one before you or something. Don't worry about that. Try to build your own like style, your own base. Avoid like compound question, or like don't ask about like alcohol and alcohol and drugs in the same question. If you have to, try to signpost first. Like for example, if you have 1 minute, so try to signpost. Sorry, we are running of time. Can I ask you like a few questions and you can answer them yes or no, and then you ask them very quickly or something like this.
I'm so sorry. I really appreciate you, Dr. Mahmoud. I appreciate you all. I'm so sorry. I just have to go, so I'll
That's fine.
leave you for it. Okay? And thank you
No
very much.
no
Jazakallah
problem.
khairan. Thank you.
وعليكم السلام. ازيك؟ سلام.
Yeah, Mahmoud, just a quick one then. How, so in terms of, so you just mentioned time. How much of a problem was that during your exam?
The daytime, or the exam time.
Yeah, so like, as in how, so keeping to time, which stations did you find you were running out of time on? And which do you think we should practice and getting more slick at?
Um, I think the station you feel you run out of time mostly the history,
Okay,
because you want to ask about everything,
yeah,
but you don't need to ask about everything. As I mentioned, you just like, for example, if you have four four to five domain, 4 to 5 symptoms as a core symptoms, just move on, because
yeah,
mostly you could say, okay, you don't need to provide like diagnosis for every station, but at least you show that like you have the core symptoms.
yeah.
And also, when you ask about comorbidities, you don't need to ask about every comorbidities. You need to ask about relevant ones.
Okay. If say for the example, so say I was to ask the patient, okay, do you have any other physical health conditions? Like, do I, and if they say no, then I don't have to, do I have to specify, okay, you don't have, just that's it. No, I don't.
That's it. But for example, if you speak, yes, that's very enough. But for example, for patient with hypochondriasis,
Yeah,
or like people, yes, you have any other physical health condition? He said, and do you have any medication? Do you take any medication? Something like this. So you start to build something relevant to the station, not to everything.
yeah,
For an anxiety, it's very important to ask about, like, if you generalize the anxiety, you need to ask about like panic, PTSD, depression. Psychosis could be important, but if you felt like spend more time with other things, you don't need to ask about psychosis, because from the point like he has a good insight, he's speaking just about anxiety. So if you miss the schizophrenia in this station, it will not be a big deal. But if you miss like mood in this station, it will be so difficult, like you will be marked less. Do you get what I
yeah,
mean?
got it.
So even in when you for mental state, when you try to like ask about persecuted delusion or delusion, you ask about relevant one. For example, if you asking bipolar, sorry, depression, and patient come with nihilistic delusion, you need to cover every somatic delusion. Yeah, like have you somatic, sorry, passivity phenomena, and also somatic hallucination and things like that. But it wouldn't add too much asking him about grandiose delusion, because he's like come as like nihilistic depressive at the moment, and you doing like mental state. So try to think about like when you do mental state specific, because I have one of my colleagues, he was doing everything in mental state, but he was not like, because of he's doing everything in mental state and history, he was missing that what would we call relevant or relevant things to to this disease or like presentation.
Yeah.
Am I clear?
Yeah, no, definitely. Because I think one thing Sarah was saying, I'm not sure if she managed to clear it or not this time, but she was saying timing was the major issue. Um, and yeah, it's just trying to figure out, okay, um, what
Timing is a
the
major issue.
task
That's
is.
what that's why I told like we spoke about like when you approach the exam or the month before the exam, do it like back to back station. For example, time 1.5 minute, not like giving, okay, I will give you this station and 1.5 minute will start. No,
Yeah,
just like speak, like try to do it with who's you practicing with. Okay, we will start now. So we
yeah,
will have 1.5 minute station. You don't need to even give a space between a station.
okay,
So I prepare this beforehand, like all the station in the same file, and
yeah,
give him the fourth station, and he will do the same.
okay, nice.
So you will have you will by doing this you will know how what station you struggle. Because I did this with my colleague, one of my colleagues, and he did it station to me. I and in the last station he said definitely you know this station, but because you have been tired, you didn't do it well, which was happening with me the first like first trial. I
Yeah,
got so exhausted because I nearly slept 1.5 hour.
okay,
So it wasn't that I didn't know the station, but I was definitely exhausted because of like just trying to focus like this 2 hours or 1.5 hour.
fair enough. So yeah, to try and get that, trying to be able to basically to be well enough to get through those stations. Yeah, cool. Yeah, and so like in terms of so when you went to the exam, out of those 16 stations, how many do you think I could never have like even if I revised for 5 years, I never could have prepared for that? Like how many stations would you say
None.
none? So everything was things that you would have expected to come up.
I would say yes. But
Cool.
definitely, or like the station, I did think that I will pass this. I could have like didn't pass, and
Yeah,
vice versa. Because at this point, at the exam day, you need to be not as so exhausted. And during the like even sometimes for myself, it was some fluctuation between the station. I
yeah,
got some block or something like one of the station I can't remember very well. I said I will not pass this station because the examiner, sorry, the role player was, oh, what did you say? And he was doing like this exactly. Oh, what is it? And he was super annoyed. And I said, okay, I'm not like I'm not passing this station. And unfortunately, I know this guy from one of the mock exam, and he was so rude during the exam. I said, okay. When I saw him, I said, oh, I'm not passing this station. And when I started to speak, and he was saying everything, oh, what do you what are you telling me? What did you say? And he was like approaching like this. I'm not right. And I said I will not bus this station. I think at this station I got 84 or nearly 90 something.
nice.
So yeah, and it might be not impacted my performance this station, but definitely this was my feeling after this station. So if you didn't try to distract yourself, this will could impact the another stations that you can do very well.
Yeah,
And even if you don't know if you don't like know the station, Hindaya and some people are speaking about this. Uh, you might say if it's very acceptable that you say, okay, I don't have this at the moment. I'm going to have a look and come back to you. A lot you might come with this examiner that said, okay, he's like very good. Like he said he didn't know about this thing and he will come and speak to me. But what station could not like come and you will not know about anything about like for example cognitive analytical therapy. I didn't practice station. I said, okay, if this station come to me, I will not able to speak about it. But when you try to think a bit about like calmly about the station, okay, patient will come and he will speak about some difficulties, I could speak to him. Okay, this will some of the talk therapy that help you to understand more about the this and this that you mentioned to me, and you will have a meeting with the therapist to speak about how many sessions you have, and he will act on your
So
pace,
you just
and
basically
we'll
mirror
see.
back to him saying, okay, so you've got a problem with, okay, you can't get your, I don't know, you don't know how to open the door. And then he's like, say the patient says, oh, I don't know how to open the door. And then you say, oh, well, the therapist will teach you how to open the door. Is that what it is?
Yeah,
Yeah.
and you might be even marked well because who's like examining you. I said, okay, he put patient at ease. He good to communication. He knows his like
Personalized it.
limitation, and he personalized that.
Yeah.
But if someone just go, okay, I'm going to tell you about cognitive analytical, it will work with cognition, and this will help identify negative thoughts and analyzing what related to these thoughts. And because of the therapy, you will have a homework. So you said everything technically,
Yeah.
but he will just like get marked like you didn't listen to the patient, you didn't give it like you didn't personalize it to the patient.
Yeah.
It wasn't two-way communication, and it was bit formalic.
Yeah.
And this happened
See,
with one of my colleagues about TMS. He mentioned everything about TMS, and he said why I did fail this station. But I'm sure, I'm not. I'm sure. I would say from I know him very well. He might say it in that way. He didn't that give the patient time or didn't personalize it to the patient, which they like people.
perfect. Yeah. Thanks. Because I don't know, my worst case scenario, and I do get like, what's the word? Uh, what I know, not like anxious, but like what I really don't like is going into a situation and not knowing what to do. That's what I hear. And then if a station comes up and it's something that I don't know, I've never say for example, right now, if you asked me to counsel you on cognitive analytical therapy, I wouldn't be able to do it, and I would really hate that. That's the thing. And like DBT again, if that came up, and I know obviously I know it's come up in the past now, but if that comes up again in the future, I'll know how to deal with it. But if you give me another therapy that I've vaguely heard of, again, like I've done like structural family therapy, um, but I couldn't counsel you on systemic family therapy if you asked me to, because I'm not sure what the differences are. But I do
Yeah,
know, oh, family therapy, it'll involve the whole family. They'll talk about your problems. The therapist will be there. The therapist will discuss things with you. It's all very similar that's from what I can tell.
yeah. Those two example. I spent half a day trying to memorize ADHD symptoms. How can I memorize it? And then next day after I failed to memorize them, like with different things like VGT, focus, try to have different mnemonics to try to memorize them. Half did literally. And then next day I said to myself, how stupid you are just trying to think about like memorizing all the criteria of ADHD and what will happen during the exams. They will say like this patient come very hyperactive and mother like complaining about this and what you just need to do. Tell me about him. Said he just like been all over the place. Oh, so so was over the place. Is it like he have any? Did anything happen as a consequences of is he taking the risk? Like, is he doing things without too much thinking? Is this happening in his school and at home? Tell me about his attention. Is he able to focus? You don't need to like have more like 5 or 9 symptoms, and then because it will you cannot even if you memorize all the criteria for ADHD you will not able to ask about them, otherwise you will lose time. Do you get what I mean? So you have like 4, 5, 6 criteria, I would say, and you say, okay, I'm just like try to exclude few things that could be related. Ask about autism, ask it about epilepsy, ask it about like other like other physical symptoms, any stressors, stuff like this. And at the end of the station, if you say, okay, it seems to me from what you're telling me that like he's been hyperactive, he's been all over the place, seems he's not able to focus, and he's not completing the task, and he doing doing the things without too much risk. It seems to me this could be due to ADHD. We need to see him. We need to do more tests. You will get full mark. But if you do like that similar to what I was trying to think, that I need to memorize every single criteria and have a good smooth question for every single criteria, definitely you'll not manage to come to this conclusion, and you will lose the station.
Yeah.
You get what I mean? For
Yeah.
DBT, I have it in my previous exam, and I thought I will fail it, and I passed it. But because I panicked, I would say, because what happened, I started the station saying to the patient, um, tell me about the difficulties that you have in the past. She said, I don't want to speak about the past. So I said, okay, so if you don't want to speak about the why I'm doing here? So I said, okay, I'm not going to buzz the station, but I started to say, okay, let me speak about. I know that like you've been recommended for dialectical behavior therapy, and it's okay. Dialectical behavioral therapy is dialecticals mean two things can be present at the same time. For example, you have some difficult. I read from the notes that you have some difficulties managing your emotion, and this can lead to for doing some self harm, and this will help you with this. And for and there is you will sit with your therapist agreeing how it could be helping, and this I'm just what I was just trying to reflect on what like that she said like has presenting in the stem, that she's self-harming, have difficulties with emotion relationship and all this stuff. I tried to bring this and said this will help you to build a relationship, and you will have some skills to help you managing like a difficult time. I paused the station. Even I thought I didn't pause it, I will not pause the station. And she was just saying to me, okay, okay. And every time, every now and then, okay, am I clear so far? Do I need to explain more? She said, I don't want to speak about the like, I don't want to speak about groups. I said, okay, uh, but it has been helpful for other people. Would you consider it? She said, yes. I will consider thinking about it. This is the only, I think, this only sentence she mentioned to me. I was frustrated about the station, but I think I managed to pass the station. Even I did think I will not pass the station. But I could do it better if, for example, I said, okay, I can see that you are a bit angry about, and you don't want to speak about the different, like the previous experience. Why you don't want to speak about the different? If said because it's like just like I don't want to speak about it, just move on. Or she might say, okay, because it was difficult, I was not able to manage my emotion at this time. I just like hurt myself. Okay, so oh, I'm sorry that this happened, and this exactly what this therapy will help you with, dealing with what you mentioned or from the stage. And this will happen. This will come. This will you can repeat this with cat or anything that you haven't been prepared for it.
Yeah. And then with the with all that, like, do they, in terms of like questions and things, what are the chances that they'll have like a list of questions? Because when I've done medical school exams here and we had psychiatry stations, usually the patients had a list of questions to ask, and if you answered those to like a reasonable level, you'd pass. In the CASC, do the patients always have questions? Okay.
And usually in management, and most of the people worry about not mentioning like specific management, and this drive like make us more formalic, that we want to just like give more information. But if you give the role player time, he will ask you.
Okay.
So you have your like structure in your mind, but try not to force it to the patient, especially in management, as you mentioned, because they have like the like question, and they will try to ask you.
Thank you so much for this. And I'm sorry I couldn't join earlier.
No worries.
Question. I finished my on call. Huh?
Sorry,
There.
we cannot hear you well.
Yeah, I was telling you this. I just finished my on call, so I couldn't join earlier.
No
Question.
worries.
So with
Can you hear, guys?
the
Yeah. Ah, she's gone. Is she?
no, no. Hello, you cannot hear me?
Now
We
we
can
can
hear
hear
Hello.
you.
you now.
Okay, yeah. I would just want to ask you about the role player. Were they cooperative? Were they provide you with all the information, or was it difficult? How is it? with the MSE station and these things?
I would say that it's variable, but most of time they are try to be cooperative. But 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 it's variable from day to day, variable from one to one, from even like because sometimes you start the station or something and it's make it put them not at ease. I would say, for example, for this patient who was speaking to me about DBT, I said, okay, so if you don't want to speak about the bus, that's fine, and we can move on. If I'm repeating the station, I'd say, is it anything particular that you don't want to speak about this? If she said just because I don't want to speak, oh, it's okay, I will move. So it just a skill how to put the patient or the role player at ease. And sometimes don't worry about like if the patient like a role player appears to be as a difficult one because sometimes they agree on the day that they will be difficult for this station just because they test how you deal with the difficult patient or this cannot affect you or like stress you with the exams that you manage this. You get what I mean? So sometimes they do this on purpose just to test something.
Okay, so it makes sense. And one more thing with the psychotic patient, because he's psychotic, for example, he is paranoid and suspicious. How is it with them? Is it easy to ask question? Is it easy to direct the interview, or how is it?
It's like reflecting on them. It's like it's much better than we practice together. Because for most of the psychotic patient I have seen, they bring something positive since the first like minute they enter the station or you enter the station, they start to look around or do some things that you notice. But if they do this, like don't comment on it from the first time. Give it some time, like comment about it after like a minute, or if he repeated it, or if he continuously doing it.
Okay, it makes sense. Yeah.
Yeah, only sometimes if he, as I mentioned, as I was speaking about a patient, I imagined that I will not pass the station and I got higher mark on it on this station. He was like somehow like trying to, oh, what do you say? Huh? Oh, doing something, and I started to, I'm not to speak. He cannot understand me, or I'm so tired to speak,
Okay.
or my accent or anything. And I got very good like mark in this station. But I believe it's something he was doing intentionally for me or for other people to comment that he's a bit tense or he was trying to act like this.
Okay, fair enough. Yeah. Okay. Thank you so much.
No worries.
Fair enough. Thank you, Mahmoud. When are you next free?
When you practice, send me that you're practicing, I can